Yes, welcome everyone. So far, I think as we were just told, we have quite a few people registered, so we're hoping we'll have a chance to come before we really get rocking and rolling, if you will. So we're going to just wait briefly, but thank you for coming, and we are quite sure this is going to be a helpful webinar for folks who are looking for some help that may be actually supported by Medi-Cal services and the possibilities of getting Medi-Cal coverage, which we think perhaps people don't know how much more possible it is than it used to be. Let's put it that way. At least for now, to what we know in this moment. So as we getting into, and there's Serene. Oh, that's so lovely. We're having a few more people joining. And since the time is relatively short for a lot of material, let's go ahead and as people join us, we're going to definitely have this recorded. And people can go back and see what they might have missed or want more information about. And so if you would, Luwada, let's put up the first set of slides. There we go. Okay. So this is the headline, as you can see, how Medi-Cal can be an assistance for long-term care, okay? We all know that it is eligibility driven in large part by income and income basically, but it is more, let's say, lenient than most of us realize. You can own your own home. And what I wanted to say with this first slide is there's a part of Medi-Cal called home and community-based long-term care. And that is in contrast to skilled nursing, which skilled nursing is the same population as those eligible for home and community-based long-term care. But these are programs that help you stay and keep your loved one in your home. That basically says what I have just said. It allows participants that are nursing home eligible. That means they are that dependent. They have custodial care needs, if that's meaningful to you. And with this support from Medi-Cal, home and community-based services, there really is a program to help people remain living with their families in the community. So this is sort of the layout of today's program. My name is, as you can see at the bottom, I'm Susan Musicant, and I'm a geriatric certified physical therapist, doctor of physical therapy, and I am Daybreak Injury Prevention, and I work as a PT at the PACE program, Center for Elders, for 25 years. So that's me. So we're going to have folks coming on, number one, if you will, care partners Froy, Romero, and Lily also is here from Care Partners to present what they do, and it's right here and now. They really have a lot to offer folks in this department. Then we'll go on to the Dementia Care Cafe, which is a program that provides something relatively new and helpful for caregivers managing their loved ones at home. And Reverend Barbara Galloway Lee will also be part of that sharing. And then I will present about PACE, having lived there. And last but not least, we'll tell you a short story about one of the participants in the caregiver group who got this kind of coverage. So let's see, next slide. From here, let's go right into rather than go on to this slide, let's go right into Freud. If you would share your screen and go ahead um, and tell us about Care Partners with Lily's help. That'd be great.
Mhm. Awesome, awesome. Thank you so much, Susan. And good afternoon, everyone. It's a pleasure to be here, and I want to thank Susan and everyone in the Daybreak team who invited us to be here and to talk a little bit more about our services and how we can support you. So I'm going to go ahead and quickly share my screen. And then I just want to make sure folks let me know when you're able to see my screen. I just want to ensure that everyone has access to and is able to visually see our slides.
Yeah.
Okay, awesome, awesome. So for today, I'm going to be quickly talking about an overview of the IHSS program, right, which is In-Home Supportive Services. And just a little quick overview, right? With that, I'll be the presenter for today, and I'm with the Care Partners program, and I'm a community outreach worker, and we focus on supporting older adults in Alameda County and making sure that we're helping them improve their quality of life. Um, but a disclaimer that I do like to share, right, with folks is we are not IHSS, right? We are funded by IHSS to provide care coordination support services to IHSS recipients and care providers and those who live in Alameda County. So, like, let's say you're like, hey, Froy, you know what? I'm interested and I want to see if I can apply to IHSS, right? You can reach out to our program, Care Partners, and we're more than happy to help you out with that application. So just FYI, we are not IHSS. We're Care Partners, but we're funded by IHSS. Susan, yes, I see you have your hand up.
Thank you. Thank you. I want to emphasize that this is one of the benefits of Medi-Cal.
Mhm. No,
Important.
definitely.
Yeah,
Yes, yes.
yeah, and we are definitely going to talk about how you become eligible for Medi-Cal. So we'll go there.
Okay, awesome, awesome. Thank you so much, Susan. Alrighty. So this is just a little quick overview of our table of contents. So we'll just go over overview of IHSS benefits, eligibility criteria, and how to apply. So that's going to be the main chunk of today's presentation. Oh, sorry, I went a little bit too fast. So an overview of IHSS, right? The In-Home Supportive Services Program is a statewide Medi-Cal program. Just like Susan said, right? This is a benefit of getting on Medi-Cal. And it's a program that provides long-term services and supports for California residents who are aged, blind, or disabled, and at risk of nursing home placement. And the available benefits include personal care assistance and homemaker services to assist individuals in living safely and independently in their home or the home of a loved one. And program participants have the option to self-direct their care, which allows them to choose and hire their own caregivers, including friends and relatives, right? And this is also to something extremely important, right? Because your home is your place of rest. It's your sanctuary, right? And so, having someone coming into your home, right? You don't know who this person is. And so if you're able to hire someone who you already know, a family member, friend, a neighbor, right? That also brings you a little bit of peace of mind. But also too, right? The beautiful thing is that for anyone who also applies to be a caregiver, right? They go through an extensive background check. So also to the list that you are provided from folks in the community are folks that already have been vetted, right? And you can also reach out to the IHSS program too to learn a little bit more about their caregivers and how you can get a caregiver. But the benefits of IHSS, right? So you're going to go ahead and have a needs assessment that's going to determine whether you qualify for the program and its services and how many hours you can receive, right? So monthly maximum amount of hours are 195 per month for those without severe impairments, right? So this could be just someone who just needs assistance with cooking, with maybe cleaning, maybe doing some grocery shopping, things like that, right? But while there are folks who may be severely limited in their functional ability, can receive up to approximately 283 hours per month, right? And these are folks who are homebound or bedbound, and who have limited functional ability, who can receive a little bit more support. And so these kind of services include homemaker services, so like house cleaning, laundry, shopping, errands, paramedical services, wound care, catheter care, injection assistance, personal care, so like non-medical assistance with activities of daily living, so like bathing, dressing, toileting, eating, protective supervision for folks who are cognitively impaired, and to help prevent accidents or injuries. Teaching and demonstration services, so like I'm doing housework, preparing meals, bathing, etc., and transportation assistance, so like escorting like to and from medical appointments. So these are some examples of the kind of services in-home caregiver can provide to you. Okay. And then also two other benefits of IHSS that's continued, right? IHSS services may be received in one's home or the home of a family member. Persons cannot be in a community care facility or long-term care facility, right? Because when you're already in a skilled nursing facility or long-term care facility, right, you're already receiving 24-hour care support, right? There's nurses, nursing assistants, CNAs who are coming, providing you their meals, your meals, they're doing some medication management, right? They're assisting you with bathing, right? Dressing, right? So these things that an in-home care worker would do. So that's already being provided if you're at a long-term care facility. So that's one of the ways in how someone could be declined or rejected from the program. And then also too, right? Note folks who reside in long-term care facilities and have a planned discharge to return home can apply to IHSS prior to being discharged, right? So let's say you have a loved one at an in-home care center, more specifically like a skilled nursing facility, right? Those places already have social workers there, right? Who your loved one can connect with to start beginning that process, right? Of applying to IHSS, right? So I think that's one important thing that I want to know is that folks can start planning to apply for IHSS if they already have a discharge plan. Okay. All right. So who is it for, right? What is the eligibility criteria, right? So you have to be a California resident. You have to be 65 and over, blind or disabled. You must have Medi-Cal eligibility determination, and you must live at home or in a abode of your own choosing. Acute care hospitals, long-term care facilities, and licensed community care facilities are not considered your own home, okay? All right, so now we're gonna go ahead and move into the financial criteria for eligibility, right, for IHSS. So in terms of starting effective April 1st of 2024, so this was actually last year, the monthly income limit for a single applicant, so just for one person, right? The maximum amount is 1,732, right? But when both spouses, let's say, two people who are in a marriage are applying, right? The spouse's applicants and the couple's income limit increases to 2,352. But let's say, right, there is a couple, right? Wife and a husband, but only one person is the applicant, right? So the income, so let's say the wife is applying, the wife is the applicant, but the husband, right, is not applying, right? So the income of the non-applicant, so the husband who is not applying, is not counted, right? So it would just be the income of the wife. And also too, for assets, right, there is no asset limit. Effective January 1st of 2024, an applicant's assets, regardless of value, are not considered in the eligibility process, right? And that could be, let's say, for example, an asset could be a home, right? Because we know here, living in the Bay Area, right, just because you have a home doesn't mean that you're okay, right? Unfortunately, I wish we could say that if someone owned a home, they would be okay. But sometimes even if you own a home, you're still struggling, right? To, get by, pay your food, pay your bills,
Yeah.
get medication, things like that, right?
Eggs
I'm
not on.
sorry, I'm hearing some talking in the background, so can folks please mute? Thank you so much. So right, just because you have a home shouldn't disqualify you from receiving these services. So thankfully now, if you have a home, that doesn't take away, for you applying to this program. Okay. And now for medical eligibility, right? So one thing that I do want to say, right, our program Care Partners, we don't determine medical eligibility for you in the program, right? This is something that you would get from your healthcare professional, right? From your PCP, from your cardiologist, from your neurologist, right? Folks who are on your healthcare team, and they would fill out a form called the SOC 295, which is the healthcare certification form, right? And that's where your physician would write down your need for getting into the IHSS program, right? So, for example, right, you would need to have a medical need for care services, and you'd be at risk of institutionalization. It's a tongue twister for me. With, so like kind of like nursing home care without program assistance, right? So upon completing your IHSS application, a needs assessment is completed by the social services agency in Alameda County, right? So like I said, right, I'm with public health department. That's a whole different agency, right? So public health, we just go out, we'll help you fill out an application, things like that. But then a social worker from social services agency will come out and do the assessment, right? They'll be able to see how much assistance do you need with your activities of daily living, right? And to be able to see, well, how much more support do you need with an IHSS program? And also to, right, folks who may have cognitive impairments or who are related to dementia, things like that, and have difficulty or, trying to retain information or problem solve, can also be considered for the IHSS program as well. It's just not like, I just don't want you to think like, oh, well, what about like, what if it's just physical abilities? No, too. Also, to mental capacity is also can be a consideration as well. Okay. All right. So how to apply? So here I have a link to the application for IHSS, right? This is the main one that you would apply to. So I can go ahead and quickly click on it so you all can just see really quick, just get a quick overview. Oh, what does the application consist of, right? So it's a lot of demographic information, gender identity, sexual orientation, veteran information, if you receive any kind of benefits, who lives in your home. They also have a section for ethnicity and language information, right? And if you have any accommodations for your communication style, right? So this is the kind of the application you would fill out. And then let me just quickly show you. And then this is the application. This one, the healthcare certification form, this is the SOC 873. This is the form that your physician would fill out, right? So they would determine the medical need for IHSS, right? So you don't have to worry about Section A. That's completed by the county. You would just do Section B, and your healthcare professional, your physician, your PCP would do Section C. And it does require a wet signature from your physician, okay? So you would need to have that completed, take it to your doctor's office, take it to your next appointment and be like, hey, doctor, can you fill this out for me? And I think that's usually best, right? Because I know also too, there was one client that I had who was a patient at Stanford, and the patient was trying to email their documents to their doctor, and they're like, oh no, we're going to charge them a $25 fee. We're like, what? Just to send them documents? To me, that was just crazy for the fact that like, hey, you're charging a patient $25 for their doctor to fill out documents so that they can get services. It just didn't make sense to me. But if you have an appointment coming up, just take these forms and have your doctor fill it out so you don't have to worry about any extra fees. Okay. All righty. Okay. And so basically you have those two forms, right? You turn them into IHSS, and they'll probably ask you, right? So like, your ID, your social security information, right? And program applicants, once you apply, you'll receive a notice of action to see if you've been approved or denied for these services. If approved, the authorized services will be laid out and how many hours per month you have been permitted. And also, too, I do want to say this, and I want to preface this. Please, please be patient. If you do decide to apply to the program, the application process can take about 3 months or even longer, right? We just recently connected with the IHSS staff, and they're like, yeah, they're mandated to process applications within 45 days of submission. But because they have a lot of high turnover and things like that, now it's up to, I think they're now processing applications within 2 months. So the wait is now even longer now. And generally, it takes several weeks to complete the application and gather all supportive documentation. And if the application is not properly completed or required documentation is missing, the application process will be denied. Okay. So I do want to say that. And let's say if you have a loved one, let's say you know someone in the community. Well, hey, I know someone who used to be in IHSS over a year ago, and they haven't been receiving services for a year. Are they still in the program? What's going on, right? So if it's been more than a year, folks would have to start that process all over again. So just clarifying that if you do get approved, making sure you stay on it, because if you do get off of it or you don't have a care provider for over a year, you have to start the process all over again. Okay. All righty. So now this is just a little bit really quick evaluation assessment. I know I don't want to take up a lot of time, but basically a social worker will come to your home, will ask you just a bunch of questions, right? And these are very personal and intimate questions. And the reason I say this is because I get a lot of clients, right? I'm Spanish speaking, I'm Mexican. So a lot of my clients are like, mijo, hey, I only got 20 hours per month, right? But I'm taking care of my mom and I do way more than 20 hours per month. And usually I tell them, were you honest with the kind of support that you needed, right? Because they can go into questions of like, do you need help going to the bathroom? Do you need help with personal hygiene after using the bathroom? Do you need help pulling up your pants, right? These are questions that can be very intimate, right? And so a lot of the times, and thinking about our Latino community, because folks don't want to be honest, they're like, oh no, I'm too embarrassed. They're like, no, I can go to the bathroom by myself, right? But the social worker, all she's doing, she's just inputting the answers that you're telling her into a computer, and that system is generating automatically those hours, right? And so the more honest that you are with the support that you need, the more help that you can get. Yes, Susan?
So you've given us a lot of incredible information. I wanted to take a minute to see if there are any specific questions. And I do have one myself, which is,
Okay.
do they have to do a separate application to Medi-Cal, separate from the IHSS application?
Correct. Yeah, you're right on point. There is a whole separate application for Medi-Cal, right? This is already, folks can apply to IHSS once they have been approved for Medi-Cal, right? And so that would be after, right? So that there's a whole separate bunch of paperwork that folks would have to do to even apply to be on Medi-Cal. And to be honest, with that process, I think folks in our program, we mainly focus on more on helping people apply to IHSS. We don't really have a lot of experience of actually applying directly to the Medi-Cal program. But what I would recommend folks is, go ahead and check out the nearest FQHC in your area, right? La Clínica de la Raza, Asian Health Services, a lot of those programs, clinics already have specific departments to help you apply for Medi-Cal, right? Or you can just go to the Medi-Cal office, the main one in Oakland, right? If you're an Oakland resident, the one at Eastmont Mall on the first floor, there's the Medi-Cal office right there, the main one, the whole branch of Alameda County. So you can just go ahead and get some information there and apply. So that's what I have to share. Do folks have any more questions? Nope. And Susan, did you have any more questions before I continue?
I think unless you have something pressing, we should consider going on. Is there something more like, did I cut you off before you were complete enough. And if I did, I'm
Uh,
sorry.
no, no, no. I think I'm almost done real quick. I have, I think, two more slides and then I'm good to go.
Okay.
Awesome. Thank you. Thank you. So yeah, so just making sure, just a reminder, folks, making sure to be honest with the kind of support that you need so that you can get the maximum amount of hours through the IHSS program. Okay. And this is basically it. You are entitled to an evaluation assessment once a year. And if there has been a decline in health faster than that 1 year, then you can go ahead and apply and have the healthcare certification form completed to get that evaluation assessment done more prior than the year. And then I'm just going to quickly actually jump into lastly about our services. So for us, for Care Partners, as you know, we provide free support. We can help you with getting DME, and we actually get the DME through Miss Susan. And this is only when there has been just a last chance, right? We first try to get it through your doctors, and we connect you to resources. But if we can't do that, then Miss Susan is our last resort. And then these are other things that we can support you with is navigation of the complex healthcare system. We also have people who speak Spanish, Cantonese, Mandarin, Vietnamese, and Korean. And we also do life care planning. So if you need support with doing an advanced directive, we'd be more than happy to walk you through the entire process. So yeah, so if folks want to just reach out, get support from Care Partners, here's our phone number, 510-577-3517, and please give us a call. A lot of us work from home, so if you go to our office, we probably won't be there. So we don't want you to make that trip over and we're not there. So give us a call if you need some support. And with that, I am done with my presentation. So Susan, I pass the mic back to you.
Great. Thank you so much for that, Roy. And I just want to say that we will talk some about getting Medi-Cal eligibility in this in our webinar today. It is a bit arduous, like the IHSS, but it can be done, and that's really the first step before you get to the IHSS, which is an incredible support, the IHSS, but you have to begin with that. That said, I'm going to ask Roger and Reverend Barbara now to talk about the Dementia Care Cafe, okay, which is a program of Daybreak that offers respite support and caregiver support. Okay, it's a pioneering program that's trying to meet a need that I think we all know is just beyond pressing. And so this is a way to provide adult day programs and support for the caregiver. And Roger and Reverend Barbara, if you could speak to that. I know the program that you've been working on now for so long and so hard has made great progress. But if you can just give people an idea of what's out there and how they can get involved.
Yeah, I'll start off. Hi, everybody. It's good to be here. I'm glad you could be in attendance. I see some familiar faces out there, and thank you so much for being here. So, yeah, so what is a memory cafe, and what does Daybreak have to do with a memory care cafe? So if you Google uh, memory cafes, you'll get all kinds of results. And kinds of cafes out there in the landscape, and what they're designed to do is kind of address the needs, the challenges of family caregivers and those that they care for. Typically, that would be folks that are experiencing memory loss. Um, so what we're doing at Daybreak, we have the fortunate opportunity through the Stepsky Foundation to generate a pilot program to provide a structured cafe model that any other organization, if they wanted to implement such a cafe in their own community, we'd be creating a guidebook for them how to do that. And that covers everything from kind of staffing an organization would need to the programming, to the kind of programming for care receivers, those that are experiencing memory loss, and programming for care providers, caregivers, for all the myriad of challenges that they face, which are many. So the Memory Care Cafe, that's the instead of a memory cafe, we're calling it a Memory Care Cafe. So it's a structured, supportive, and welcoming environment that utilizes programming, and it reflects the participants' interests, their challenges, their culture, um, and addresses and targets those areas very specifically to help support them in meeting those challenges and hopefully providing a means to enhancing their day-to-day lives. So memory care cafes can be held anywhere from 4 times a month. It's really up to the person or to the organization that's holding a cafe. That's hosting it. It can be for any length of period of time. The one that we instituted with Beth Eden Baptist Church is for 3 hours, and that would include like an hour of group activities with care providers. We call them care partners being care receiver and caregiver. And there'd be a variety of activities that they can engage in together. That helps build a community, get to know one another, become familiar with one another, followed by breaking bread as a group, having lunch, and then you would have breakout sessions following that. And you would have programming targeting the care receivers, things like activities to stimulate cognition, physical activities to keep everybody limber and moving. And for the caregivers, you would have programming such as caring for the caregiver support group. You might have guest speakers that come in and provide information on topics about either caregiving or might be anything from how to engage in self-care as a caregiver to learning more about dementia. Um, just you name it, whatever challenges the caregiver is facing, those topics can be brought into that space and discussed, and you can learn more about it. Um, so there's a lot of learning opportunities, support services, uh, ways to navigate and caring for those with dementia, how to care for oneself. Um, some cases, some cafes, if you Google it, they'll have a specific focus. And so one cafe that's out of state, they're focusing on early onset dementia for people like in say like in the 40s and even younger. And there's would be challenges that are built around that as well. So our Memory Care Cafe pilot program is in 3 phases. Phase 1, we began with Beth Eden Baptist Church back in May through December of last year. Now we're in phase 2, and that goes from January until July 1, and that we're currently tweaking the model, making some changes, rearranging some things, and adding some components to it. And I'll get to that with regard to respite. And then in phase 3, we're going to be working with Glad Tidings in Hayward, with them, in putting out the final model to see how that goes. And then the plan is after that, we'll have a pretty good sense of what the structure for the cafe is. And we'll be creating this guidebook that we're going to be able to give out to any organization, like I mentioned earlier, that they can share or that we share with them that they can use to implement such a program for themselves. Um, what we would like to ultimately have would be to, like I said earlier, you Google memory cafes, and they're kind of scattered. They're all over the place. We want to bring in some structure and specific focus into that, and sort of provide like a hub for any organization that wants to adopt our model. This is all free of charge, by the way. There's no fees involved in this. It's something to benefit communities free of charge that they can implement. But Daybreak would sort of serve as a hub for, let's say you've got cafes in say different counties or different cities within Alameda County, and we would serve as a hub for them to kind of organize and come together under one umbrella. And then it would just, and it'd be a good way to network with other communities and to, I think it would help increase the learning, the support, and the overall health of a variety of communities. I do want to speak about respite. Susan had mentioned that earlier. So if you don't know, which you probably do, but if you don't know, one of the biggest challenges for caregivers is getting respite. And the reason it's a challenge is, like for Alameda County, there really is, I mean, there's PACE programs and there is Hong Fook. Generally speaking, it's a desert. As Susan and I were talking earlier, I like that term, a desert, because it really is a desert. There really isn't much. I was at a conference last week, California Association of Adult Daycare Centers, and I was talking to the executive director, and he was noting too that he knew that Alameda County was really didn't have much in the way of adult care centers. Um, so he kind of keyed in on what we're doing with the Memory Care Cafe in terms of providing activities and support. Um, but the one component that is very difficult to provide is respite. And respite is a broad term, and it can be anything from getting just maybe an hour um, in another room um, and not having to be responsible for your loved one in terms of you could just get a small break, just kind of a little micro break from your caregiving duties. Um, and of course, the other end of the spectrum would be having respite to where you got somebody who's like your loved one could be at an adult care center, or perhaps like Troy was talking about earlier, you have an IHSS worker could come into your home and you might be able to get out for maybe 4 or 5 hours, maybe from an hour to beyond, to go out and do the things that you need to do, whatever that may look like, be it shopping, um, not doing anything, just kind of recharging your batteries, whatever that may look like. So with the cafe, we are exploring 1, 2, 3 different avenues to be able to provide respite services. It's like the cafe, you can't just come in and drop your loved one off and leave. The California rules and regulations of such an activity are highly regulated, and you can't just do that. And you can imagine there's all kinds of liability issues. You would want to know who the people are that are taking care of your loved one. You want to know that they're in safe hands and capable hands in doing that. And there's just all sorts of challenges around that. So that is one thing that we're currently exploring different avenues, and I'm not really in a position to speak fully on those because we are just in the beginning stages of learning about them and being able to incorporate them. We have some experts in those fields that we brought in, and we're going to be working with them to see how we can apply that to the county. But we're not there yet. But the ultimate goal would be to build enough community in the cafes to where like an organic group of organic community of caregivers is formed that not only is solidified within the confines of the cafe, but it extends beyond the bounds of the cafe. When there aren't sessions happening, this group of people, these group of caregivers can rely on to one another to help out with one another. Like, hey, I got to go to the doctor, and can you watch my loved one for maybe an hour or two, and I can reciprocate and return the favor when you need time. Kind of like when it'd be like some of the for parents of kiddos, they will have, I'll watch all the kids, bring them over to my house, I'll watch them, and then Tuesday's your day, that kind of thing. Susan, you had a question?
Yeah, I was thinking people are getting a really good idea of Memory Care Cafe that we are doing, and it promises a lot. But there are, Reverend Barbara, if you could take some time to sort of talk about what's happening now and how people are getting what we're talking about in the context of your work, which gives people sort of a right now feel about
right now.
happening. And then when,
Turn it over to her.
yeah, I feel anxious to do that because I think people want to know what's there for them. And it is very exciting that we do have that happening. It is even beginning to happen with our program.
Oh, all right. Thank you, Roger. You just about covered all of my bases, but what I wanted to share is maybe a day in the life of the Memory Care Cafe. And right now at Beth Eden Baptist Church, we're meeting once a month. And there's an example of what we do in terms of activity. But Roger, you're so right about the need for respite because some of the caregivers, I do believe, just come to the program so they can have a lunch and some respite. However, an example is we run from 11 to 1:30, 2 o'clock on the last Friday of, or the fourth Friday of every month. And um, basically, there may be 20 to 30 people that come, and we call them dyads. That would be the caregivers and the care receivers. So, an example of how we break it down is we start off with, this is faith-based, so we start off with a non-denominational devotion and an introduction to what will happen during the day. For example, we had the Center for Elder Independence to preside or present to everyone. Then we broke up in a group. The care receivers did arts and crafts, and they love music. So we put music up on the screen, and it's very, very healing. Um, and then the caregivers will break. We have a very large facility, and the care receivers, the caregivers will break up into their own group and talk about, for example, when the holidays came around, they wanted to talk about holiday stress and how to care for their loved one during the holidays. Another favorite topic, this is getting into the details, is caregivers as well as the care receivers love to talk about the memories from times past. For example, we do have a very reliable neurologist that comes free. This is all free. Lunch is free. Has come many times to go over the latest that's happening with dementia. And there's always time for questions and answers, and we do an assessment of where we are and what's next. So that's it in a nutshell. My background is in hospital chaplaincy, and we do often talk about the end of life planning, and we've had care receivers that had early onset dementia to the end of life. And so we cover all stages in terms of information and education. Yes.
Yeah, so thank you for that. So just to get a real clear picture for me and for folks that watch this, so once a month at this time, you at Beth Eden, which is in Oakland,
Right.
people can come who are caregivers with their loved one to a program that will serve them, the caregiver and the care receiver, together and separately. So it really is sort of a twofer, if you will. And it sounds like it's really a great program. At this time, it's only once a month, is that right?
Well, at this time, it's once a month. For the last year or so, we had been providing the program twice a month. But right now, it's once a month. However, every Tuesday, from 11 to 1:30, we do have a caregiver support group. And so that's very helpful to the caregivers, care
And
receivers.
really important to note at the same time, we have an online support group also at Daybreak. But I did really want to feature in this webinar the opportunity to get a break and respite and so on. So I didn't really mention that, but we'll talk more about Daybreak's, kind of sweep of programs for caregivers. It's something we are really very involved with. If we could, are you comfortable, Roger and Reverend Barbara, with your presentations for now? People could certainly ask questions later and so on, not necessarily in this setting, but.
Yes, I'm comfortable. Thank
Okay,
you.
great. So let's go on then back to the slides I put together. And I wanted to talk about two programs that are paid for by Medi-Cal. That's the flag I'm waving today. You can get these services for free if you have Medi-Cal. And these are, they're called community-based adult centers, okay? And so let's see, I think this is slide 4. Oh, here we go. Okay, Hong Fook. So Hong Fook is in downtown Oakland. We were going to have this amazing OT that's worked there for years, but he had an urgent situation with his family, so he couldn't come. But Hong Fook has an adult day program. They have their own transportation. You can see what they do. They help people regain their independence. They have an OT, a PT, therapeutic activities, and they pick people up from home. And of course, the people who are taking care of them get a break. So I just really wanted to say this one program that still exists even after California did really undermined way more programs that used to be. This one's still there. It's an amazing program. And it does have this competency in Cantonese, Mandarin, and Korean, Vietnamese, as well as English and it's a wonderful program, and we've worked with them, Daybreak, very proud to have a program like this. Please consider this program for your loved one. If you're looking for something like this, it exists, and go for it. Let's go to the next slide. And I'm going to talk about PACE. Okay, PACE is another program that Medi-Cal pays for. Okay, pretty much everyone in it has both Medicare and Medi-Cal, and that everybody over a certain age or disability very commonly have Medicare. Medi-Cal is what I'm here today to tell you is available for middle class families struggling to keep their loved one at home. This is home and community-based long-term care through Medi-Cal. Just like Medi-Cal pays for SNF placements, well, now they've come a long way, and they also pay to help people stay living in their homes, just like Freud went over how important that is for people. And so PACE has, it's like it has it all. It has a day program, it has transportation, it has activities that are very appropriate, OT, PT, social work, and what you have to deal with, the package. They have a physician on staff, they've all of that. Every time your loved one needs to see a doctor, the caregiver can call and say, my loved one is stopped eating, or is whatever it is that you're concerned about, and PACE will come, either send out a nurse. It's really quite an amazing program. You cannot keep your own doctor, and that is one of the things that not everybody is ready to go along with. But I want you to know about PACE and CEI. They have 6 programs, was it, Loada, or 5 programs in Alameda County, and Unlock, another program in Alameda County, in Union City. So these are options for your loved one. Again, day program with appropriate activities, so important for them, because to be sitting alone at home for an elderly patient with dementia is really not, they can't really keep their focus, their abilities up. You, the caregiver, can't become, adult day programs are so important. Medi-Cal is in on this. This is a possibility. So let's go on. I wanted to talk about PACE. If I seem passionate about it, well, I am. And I just wanted to just give you here, before we end, just some basic terminology, kind of a review, okay? So you know what IHSS is, part of Medi-Cal. If you qualify for Medi-Cal, there's another process to qualify for IHSS, just like Freud talked about. It's doable, and that's what it is. They'll send in people, that people are vetted and trained, and you, the caregiver, can also be an IHSS worker yourself for your loved one and get paid, just saying, okay? So long-term care is custodial care, not, where we go? It is not skilled nursing, but it is in a skilled nursing facility, and Medi-Cal pays for non-skilled care in long-term care in those facilities. But as you see the next line, they also pay for home and community-based care. And I'm sort of beating this horse here. Is not dead, it's alive and well. It's really important. You can get help to keep your loved one at home. I want to talk briefly about share of cost. If you make too much money, or your loved one has properties that there's a way, share of cost in the next spousal impoverishment. These are ways that you can separate the assets of the partnership, the wife and husband, could be domestic partners also. You can separate your income and your properties such that when the loved one is no longer needing these services, probably because they've passed, the person who's been caring for them is not left impoverished. And that is the reason for this category, and Medi-Cal will help you with it if you're clear that's what you need. We know people who are doing it. It's really important. PACE I already talked about. Home community-based services, as I said, Hong Kong is one of them. And scrolling up just a little bit, maybe, Luada, the multi-purpose senior services program, part of what Medi-Cal provides, does pay for respite, meaning you, caregiver, can be away and get coverage. So I really want you all to know what's out there, what's possible. And I'm not going to pretend it's easy to get these services. It does take time and it does take perseverance. Let's go to the next slide. And there you see an organization called CANNER, or California Advocates for Nursing Home Reform, okay? And they are amazing, okay? They don't just work with skilled nursing facilities. They have a whole section of information and support. And in particular, I've put here what is, and there's a link to it, a quick guide to home and community-based programs available through Medi-Cal. And if you didn't get anything useful, but you really have this need, but somehow it just didn't get it clear enough, this guide is everything very clearly. It's kind of an amazing resource. So I really highly recommend going to this website, getting this guide, and seeing what all the home and community-based programs are available through Medi-Cal. And last but not least, this is a for-profit elder care resources. There are many of them on Google. You can Google, these kind of resources. This particular one offers a free consultation, and we have personal recommendation for amazing support getting these kinds of eligibility resources, in particular from Medi-Cal. Next slide, let's see, what is the next slide? Yeah, okay, well, this is just more about CANNER. And before I talk about this last piece, which is just basically who and what Daybreak is, I wanted to, I was hoping one of the caregivers that is participating in our Caring for the Caregiver group, she let me interview her about getting Medi-Cal, okay? And she couldn't come today because life as a caregiver is very demanding, and she wanted to, but I said, please, do what you need. We know your time is so precious. She let me interview her, and I just want to say that she said for her it took about 3 to 6 months to get Medi-Cal and IHSS, okay? She said, call Alameda County Social Services, and this information is available in this webinar, these slides, which we will send to you. They will send you a packet, she says. You will get a case number, she says, and she said, keep every piece of paper you get from them in your notebook, along with notes about everything that you talk about with them. Be patient, be sweet, and you will be rewarded. At least she certainly has been. She is getting an amazing number of hours, 40 hours a week, for her very, very frail husband, many nursing needs, skilled nursing needs, and he is able to stay at home, and it's not breaking the bank. And this is an example of what's possible for folks. And it's just felt to me so important to let you know that these kind of support is there. Even though Alameda County doesn't have day programs like we used to, we do have PACE, we have Hong Fook, and we have IHSS, and even something called MSSP, which provides respite. So I hope this has been helpful, and we will have this recorded, and on our next Daybreak newsletter, we'll have these slides available for you to see with the information. And now we are just actually to the end of the hour, and I see a few of you are left. And I hope more people will take advantage later. But do any of you have any questions? If you know me at all, I love questions. So just Serene, has this been helpful? I can't help myself. I see your beautiful face and I just want to ask.
Yes, it's been helpful. It's just that I'm in San Francisco County, not Alameda County. But the information has been useful.
Okay.
Yeah, it's an eye opener.
Okay.
Uh-huh.
Good. And things in San Francisco County won't be that different.
Right. Hmm.
Yeah. Yeah. Good. Good. Well, thank you all for coming in. Thank you, folks that are still here for contributing what we are trying to do at Daybreak. And the last slide, which I just skipped over, but you'll all get to see, is just about Daybreak and what the services are we provide and how you can find out more about support as caregivers through that. And yeah, and Karen, you have stuck through here and you're really a big part of what we provide. It would be lovely if you had just a few things to share about your program.
I had to mute because of my whiny cat. We have a wonderful 3 times a week on Zoom, a caregiver support group. A couple of our members are actually in the studio audience here. We provide really a wonderful sense of community among caregivers. So many times we talk about in our groups that people can be sympathetic of your caregiving struggles and challenges, but it takes another caregiver to know what that experience is really like. And so we have a wide variety of members that join us. It's, of course, free of charge. They come sometimes all 3 times a week, but we come together and support each other in a way that builds a community of trust and of knowing you're not alone. I think the hardest thing for a at-home caregiver is the feeling of being isolated, and that can present its own challenges mentally and emotionally and physically. Coming together and sharing each other's stories, no matter how different they are from one another, the commonality is we get each other. We get each other. And that support and that sense of community is just so marvelous to be a part of. Even caregivers whose loved ones have passed, they find themselves wanting to continue to be part of our group because the sense of community and understanding and the personal growth that goes along with that continues long after the task of caregiving is over. She supports and is an incredible member of our ongoing group. So we really treasure her presence and the presence of all our caregivers. So I appreciate the opportunity to be able to be a part of this healing and this sense of community.
So with that, I think we've said a lot in a short amount of time. I hope it's helpful for folks. We'll have it available for people to watch later. And thanks again for coming.
Thank you, Susan.
Thank you all.
Thank you, everyone.
Thank you, everybody.